Hello everyone. We are second-year biomedical student from Sunway University. And today, we'll be talking about vaginal yeast infection. Vaginal yeast infection, also known as vulvovaginal candidiasis, is a common yeast infection that is caused by the fungus Candida that has effects on the vagina and vulva. This infection is more common than you think. 70 to 75% of women will contract it at least once in their life, and in Malaysia, the rate of women who experience it recurringly is 4,800 out of 10,000 women. A common misconception about the word vagina is that it refers to both the internal and external structures of the female genitals. However, vagina is actually the internal canal, whereas the external structure is the vulva. A healthy female's genitalia contains a large variety of microorganisms to keep the genitalia clean and healthy. These microorganisms can undergo fluctuations anytime throughout a woman's life. Candida albicans is a type of fungus that is naturally present in the normal vaginal microbiota in healthy individuals. However, they can become harmful and invasive when the immune system of an individual is suppressed, hence causing vaginal yeast infection. Vaginal yeast infection can be caused by multiple factors. For instance, the use of antibiotics. Antibiotics can kill the bacteria existing in the vagina that function to prevent yeast growth, hence causing the uncontrolled growth of yeast, which causes vaginal yeast infection. High estrogen levels is also a factor causing vaginal yeast infection. Elevated estrogen levels in an individual prevents the body's innate immune system from marking and destroying the Candida albicans, leading to the development of the infection. Other than that, uncontrolled diabetes mellitus. An increase in glucose levels causes the disruption of the immune system's ability to effectively destroy the Candida yeast. Glucose also serves as a source of nutrients for the yeast. Moreover, unprotected sexual intercourse can cause vaginal yeast infection. Unprotected sexual activities with a partner that also has yeast infection in their genitals can cause the transmission of the Candida yeast. Lastly, washing the genitalia with soap. Washing the genitalia with harsh soap can upset the normal vaginal environment by the removal of the bacteria that prevents yeast growth. Additionally, soap increases the pH of the vagina, which is suitable for the growth of Candida yeast. This results in vaginal yeast infection. There are a few common symptoms of vaginal yeast infection, such as itching in the vagina or vulva, a burning sensation or pain when urinating, and redness. The presence of abnormal vaginal discharge that is white in color and chunky, which has a similar appearance of cottage cheese, is also an indication of the infection. Since vaginal yeast infection is a result of the Candida fungus, azole antifungal agents, such as fluconazole and clotrimazole, are normally used for its treatment. These antifungal agents work by disrupting the structure of the yeast. This inhibits the growth and results in the death of the yeast. Once the yeast is dead, the symptoms will start to subside. Each medication has to be taken or used in different ways and dosages. For example, fluconazole 150 mg should be consumed orally in a single dose. However, it is more commonly used for more severe cases. According to a study conducted in 2018, this drug was concluded to be the best treatment option for vaginal yeast infections. Nevertheless, it should be prescribed by medical professionals. Other than that, miconazole. This treatment functions to suppress yeast growth. There are two forms of this treatment: vaginal cream that is applied to the vulva and tablets that are consumed orally. Clotrimazole is also a medication option to treat vaginal yeast infection that is most commonly used for milder cases, and it can also relieve itching. To use the medication, the tube filled with the medication is inserted into vagina and the contents are released while you lay on your back with legs apart. Ensure to wash your hands thoroughly before the application. Also, be sure to follow the instructions on the packaging. This is because Cane's 10 has different kinds of vaginal creams containing various concentrations of clotrimazole. For example, this one contains 3 applicators, applied once a day for 3 days. Nevertheless, if the symptoms persist after the completion of the application, please do consult a doctor, as these symptoms may be an indication of another condition. Although the medications are usually tolerated by patients, there are yet several reports of adverse effects. Fluconazole can cause nausea, fatigue, and seizures, while miconazole may result in breathing difficulties, skin rashes, and swelling. Moreover, clotrimazole may cause adverse effects such as hives, vomiting, and foul odor discharge. Other common side effects that these antifungal agents can cause include stinging, redness, bumps, and flaking skin. Therefore, it is important to refer to the information on the packaging and consult a medical professional before usage. If you do experience any of the adverse effects, seek for medical attention immediately. After treatment, it is vital for patients to take necessary steps to prevent vaginal yeast infection from reoccurring. One of the prevention methods are the usage of cotton underwear that is breathable. Other than that, it is important to change out of sweaty or wet clothing as soon as possible in order to avoid moisture buildup in the vagina, which creates a favorable environment for fungal growth. Harsh or scented soaps that can affect the pH of the vagina should be avoided at all costs. Instead, individuals may use unscented mild feminine washes, or even better, just water to cleanse the vulva. Now let's see if you fully understand everything you need to know about vaginal yeast infection with a short quiz. There are 3 questions, and you have 10 seconds to answer each question. Good luck! Question 1. What is the best way to clean your genitals? A. Using body soap. B. Using a fragrant feminine hygiene wash. C. Using unscented mild feminine wash or just water. The answer is C. The best option to clean the vulva is by using unscented mild feminine wash or simply by cleaning it with water. Question 2. A common symptom of vaginal yeast infection is A. Blue discoloration of the vulva. B. Itching in the vagina or vulva. C. Painful menstrual cramps. The answer is B. The common symptoms of vaginal yeast infection includes itching in the vagina or vulva, a burning sensation or pain when urinating, redness, and abnormal vaginal discharge. Question 3. Which antifungal agent is typically taken orally in a single dose for more severe cases of vaginal yeast infections? A. Fluconazole. B. Clotrimazole. C. Miconazole. The answer is A. Fluconazole is an antifungal medication that is orally consumed typically for more severe cases of vaginal yeast infection. Did you get them all right? Feel free to replay the video if you got any of the questions wrong. Vaginal yeast infections are more prevalent than you may think, and societal taboos tend to suppress the discussion of the subject. If you experience any of the symptoms listed above, or if you are experiencing vaginal yeast infection recurringly, we strongly recommend that you seek medical attention. Your health should always come first. That's it from us. Thank you for watching. Don't forget to like and leave a comment. These are the references we used.